I am really looking forward to hearing a bit about Blyott. So let's start off and just give us the elevator pitch of what the company that you founded, that you lead, does.
We really focus on asset tracking, to put it very simple, in healthcare environments. And when we talk about healthcare environments, the focus has been so far hospitals, but we see now more and more traction coming from pharmaceutical companies, medical device companies, and also home and elderly care companies.
Mm-hmm.
Very important, what we always tell our clients is that asset tracking is only a first step. The main question and also the main value is what can you do with the data?
Mm-hmm.
And so we see ourselves more as a big data analytics company than as an RTRS or a asset tracking company. And I think that's very important to pitch. That's the pitch we make to our clients. Asset tracking is the first step. The real value sits in the data analytics and how can we help you to optimize processes, find bottlenecks in the organizations, things like that.
So your typical customer, say a hospital, why do they come to Blyott? What's the problem that they're trying to solve?
There are in fact four main problems. So let's take a typical hospital of let's say 500 beds. On average, they have 10 what we call moving or floating assets per bed. This can be a pump, a bed, an oxygen cylinder, name it. So typically 500 beds multiplied by 10, which means 5,000 floating assets, with an average value we have seen, or we have learned so far, of about $4,000 per asset. So you have a pool of money floating around of around $20 million for a typical hospital of 500 beds. Where are the challenges? First of all, nurses losing a lot of time by finding equipment. That's the first problem they would like to address. The second problem is a lot of equipment is either stolen or getting lost. I think more lost than stolen, and lost by accident. A patient is moved to another hospital. They take the pump with him and the pump never comes back. The third thing, and this is really something we try to differentiate, is helping hospitals to calculate the utilization ratio of their assets. Because tomorrow the head of nurses say, okay, we have 800 pumps, we need 200 extra because we have a shortage, but there is no way to show that. So that's what we're trying to help with. And then the fourth one is really process optimization. And then one of the things that's currently, it has a lot of attention, is what they call patient flows. How long has a patient been in the surgery room, in the recovery room, at a physician, things like that. So these are really the challenges that we are trying to fix by using Bluetooth technology. This being said, there is another very big challenge, and that's regarding consignment of products in hospitals. A lot of pharmaceutical companies, a lot of medical device companies, they put products in consignment in hospitals, and they can only be invoiced the moment they have been used. And as you can imagine, many of these big companies, pharmaceutical companies, they visit the hospital every few days or weeks just to see what's in stock and what they can invoice, and what they have to put new items in the stock. So, and this is also something we try to help with.
That's an interesting one. I think the first set of use cases are real and very significant, and I think global problems. This consignment one, you don't hear about so often. I've definitely heard about it, and I really believe in it. So who is the customer with the consignment use case?
That's something, it's a very good question, and it's still something we are trying to investigate. We think at the end it will be the medical device company or the pharmaceutical company. Mm-hmm. And just to give you an example, I cannot mention names because with some of these big players we have NDA signed, but there is one very big player, and they are selling devices which are being used during surgeries. and their global turnover is for a particular type of device is around $10 billion per year. Around 50% of that turnover is consignment turnover, which means it can only be invoiced the moment it has been used at the hospital. Believe it or not, between 10 to 15% on a yearly basis is depreciated, so is considered as being lost because they don't know where it is, and they cannot simply not invoice it. So we are talking about huge losses, both for these companies, but also for the hospitals, because at the end, they are being charged more because if somebody loses something, they are being charged more.
Oh, okay. Yeah, I was wondering about that. So you have a storage cupboard that's got a bunch of these products in, and the idea is that the nurse is supposed to sign it out, and presumably sometimes he or she doesn't do that, and so it's lost. But the hospital ends up paying for it anyway. Is that right?
Sometimes the hospital ends up for paying it. So what we have seen so far is a lot of discussions between these big players and small hospitals, because the hospital says, okay, we have never used it or we never received it. And then discussions, but we received it, blah, blah, blah. And when we came to do the stock counting, the inventory counting, it was not there. So discussions. And at the end, sometimes the hospital has to pay, other times medical device company, in order to keep the relationship intact, say, okay, you know what, we are going to pay. But on top of that, a lot of wasted time. I have another example of a company renting these special mattresses for hospitals. They put them in the storage rooms, and only when they are taken out of the storage room and brought into a patient room, they can invoice the rent of such a mattress. And every day this company goes to every storage room in every hospital just to do the stock counting, to see what they can invoice. So this is, of course, far more than asset tracking for a hospital. These are the other challenges I was talking about.
Thanks for watching this clip from the Mr. Beacon podcast here on YouTube. You can listen to the rest of this episode on iTunes, Spotify, or wherever you get your podcasts. If you enjoyed it, please like and share this video, and be sure to subscribe for more weekly videos. For more information about Blyott and IoT Pixels, head on over to blyott.com.